Hello everyone and welcome back to my YouTube channel. In today's video, we are delving into a dermatological topic that impacts many individuals. So yes, I'm talking about the exfoliative keratolysis. Simply you can say peeling off the hand skin. So if you have ever experienced excessive peeling off the skin on your hands or feet and you are curious about the causes, symptoms, and management, and especially the treatment. So, you are in the right place. This video is definitely for you. So, watch this video till end for more knowledge and stay connected with us for more informative videos like this. So, join me as we explore the intricacies of exfoliative keratolysis and shed light on how to care for your skin. So, let's understand what exactly is the meaning of exfoliative keratolysis. So it is basically a simple non-infective skin disease. It is also known as recurrent focal palmar peeling, or you can say recurrent palmar peeling. So as the name suggests, palmar peeling means skin peels from the palm region, means your hand. So it is characterized by dryness of the skin and small air-filled superficial pustules. It affects commonly palms and the fingers. It affects rarely to the soles and the feet. It commonly appears in the summer and the winter and among young active peoples. Cold weather, dry air, excessive washing of the hands are the causative factors of skin peeling hands. So basically, it is a harmless condition as it does not have chances of any infection and complications. So this is the exact meaning of kerato. So this is the exact meaning of exfoliative keratolysis. Exfoliative keratolysis or simply peeling off the hand skin. Now next we'll talk about the various types of exfoliative keratolysis. So basically three types of exfoliative keratolysis. Now one by one we'll talk about them. So let's talk about the types of keratolysis, exfoliative keratolysis. So, depending upon the skin peeling and severity of the symptoms, we can differentiate it into acute, chronic, and recurrent exfoliative keratolysis. So, first we'll talk about the acute exfoliative keratolysis, which means it is a primary stage of skin peeling of the hands. A patient complains of dry skin on the palm or simply off the palm, with initial air filled blisters on the fingers. A patient does not feel any pain with dry skin. It can be treated with an applications of coconut oil and keep your hands moist. It is a harmless condition. It can be misdiagnosed as contact dermatitis and eczema. Now, second type of exfoliative keratolysis is chronic. So it is a rarely occurring condition, and some patient complains of cracking and bleeding from the dry skin of the palm region. A patient who lives in extremely dry weather or cold air is susceptible to chronic exfoliation of the palm skin. Now, third type is recurrent exfoliative keratolysis. So, a patient complains of recurrent skin dryness every summer and after contact with the specific detergents and solvents. Sometimes continuous hand and sole perspiration, means sweating, may cause recurrent skin peeling from palm and sole regions, respectively. And specific allergic conditions and hereditary are causative factors for recurrent type of exfoliative keratolysis. Now, next, we'll talk about the potential causes. So, what is the etiology? So, let's talk about the potential causes which are responsible for exfoliative keratolysis. So, as I have already said, it is a harmless condition, but weather changes, activities, allergic conditions, and hereditary conditions are the causative factors for it. Now, let's talk about it in a elaborated manner so that you can understand it very well. So causes. So first cause is weather. So extreme weather affects the skin. Cold air, dry summer heat, or dry air may cause dryness of the palm skin and produce small blisters over the hand region. Secondly, activities. So active young adults who are sports people and athletes are more susceptible to more perspiration of the palm and sole region, which lead to the friction of the skin. And this is a causative factor for the exfoliation of the keratolysis. And saltwater fishermen have more cases of exfoliation of the keratolysis. And some studies have shown that salty water is a causative factor, but some studies shows some bacteria from fish skin may cause the peeling of the skin also. Now, next cause is allergic condition. So, most of the time, a person who is allergic to detergent, solvents, and water is more prone to exfoliative keratolysis. And people who wash their hands continuously may have dryness and peeling of the palm skin. And the next cause is, last but not the least, that is family history. So it is a rare causative factor for exfoliative keratolysis. Very rarely, some families may have a tendency for the peeling of the skin from palm and sole reasons. So these are the potential causes which are responsible for exfoliative keratolysis. Now, next we'll talk about the clinical symptoms. That is, what are the signs and symptoms of exfoliative keratolysis? So, as I have already discussed, earlier peeling of the skin, dry skin, superficial air-filled blisters on the fingers are the key symptoms of exfoliative keratolysis. It affects the palm, finger, and really the sole region. It is a harmless condition, but sometimes it may cause bleeding and cracks on the skin of the palm and the sole parts of the body. So, microscopic examination reveals cleavage with the outside horny layer of the skin, that is the stratum corneum. So, a patient who perspire a lot or more, or who wash their hands and pain. And in rare cases, a patient complains of redness of the skin with bleeding and pain. The primary stage of peeling of the skin is the eruption of the superficial air-filled blisters in a focal area of the fingers in the palm, and slowly it leads to dryness of the skin and the peeling of the skin eventually. And it may be misdiagnosed by some doctors with the psoriasis, contact dermatitis, and eczema, because some patients complains of exfoliated keratolysis after the use of solvents, detergents, and salty water. So don't get confused. Okay. Next, we'll talk about the risk factors for exfoliative keratolysis. So, exposure to the harsh weather, allergens, and family history are the risk factors for the peeling of the skin from the palm. Now, next, we'll talk about the investigation, or simply you can say diagnosis. So, how to diagnose? So if you have any doubt that you are suffering from exfoliative keratolysis, so what are the various tests that one can perform in order to diagnose it? That actually you are suffering from exfoliative keratolysis. Let's talk about the so let's talk about the investigation criteria. Okay, so exfoliative keratolysis is a harmless skin condition, as I've already said. So diagnosis is depending on the clinical features, family history, personal history, and some lab test. Skin appearance is important to diagnose it clinically. Typical skin appearance Typical skin appearance is dry skin, air-filled superficial blisters on the fingers, and the peeling of the skin present on the palm and the finger region only. And occasionally, exfoliative keratolysis affect the sole part also. Family history and the personal history in detail are important part to diagnose peeling skin conditions. Some patient may have a family history of exfoliative keratolysis, and some may have allergy to detergent, solvent, and water, which lead to exfoliative keratolysis. So lab tests which are required to confirm the diagnosis of exfoliative keratolysis from other similar conditions like contact dermatitis, fungal infection, and psoriasis. So first lab test is skin biopsy. So, skin biopsy confirms the diagnosis if of it shows cleavage and a partially degraded edge or and a partially degraded edge at the horny outer layer of the skin, that is corner desmosomes within the stratum corneum. Another test that one can perform is skin scraping. So, a skin scraping was sent to a laboratory to diagnose fungal infection. And a patch test is also used for the evaluation of any potential contact allergy. So, most of the time, diagnosis of the diagnosis of the exfoliative keratolysis depends upon the clinical features of a patient. This was all about the investigations. Now, next, we'll talk about the treatment. So, what is the ultimate treatment for exfoliative keratolysis? So, yes, we are talking about the homeopathic treatment. Now, we'll talk about the best homeopathic medicines which has been used for the treatment of. So, homeopathic medicines are useful for treating the tendency of exfoliative keratolysis and the acute cases also. There are the medicines as well as the cream, or you can say ointments and the lotions available for the exfoliative keratolysis. To a patient, so to treat a patient with the help of homeopathy, we need clinical features, personal history, family history of the patient, and there is no generalized homeopathic medicine for exfoliative keratolysis. Every patient manifests the peeling of his skin differently, so each patient requires a specific remedy. Is like dryness of the skin with the blisters. So homeopathic treatment follows individualization. Therefore, no two patients are similar and everyone requires a remedy that suits that person only. On the other hand, creams and lotions are also helpful for everyone for external applications. Now, the first and the foremost homeopathic medicine that you can see here on the screen for exfoliative keratolysis is Illumina. So, Illumina is a good homeopathic medicine for the chapped, dry, tortuous skin. Skin symptoms return every winter season. A patient complains of itching when getting warm in the bed, and skin complaints are associated with constipation. Now, ointments externally 2 times a day. Now, second medicine that is anacardium. So, anacardium is indicated for dry and the thick skin of the palm region associated with the vesicles on the fingers. A patient complains of swelling of the fingers. Or simply, this medicine is indicated for exfoliative keratolysis with warts on the palm. And it is also associated with the mental irritability. Next medicine is bismuth. So, this is especially indicated for excessive dryness of the skin of the palm and the sole region. Dry skin is associated with a warm perspiration. A patient has cold limbs, but the palm and the sole are warm. Now, the next homeopathic medicine is Calcarea carve. So, this medicine is indicated for exfoliative keratolysis of palm from hard water. This is basically a chronic remedy. It can be helpful to reduce the tendency of the recurrence of the exfoliative keratolysis. A patient complains of chapped hands after the use of hard water. A patient has dry and the raw soles of the feet because of the cold sweat on the feet. And patient may also complains of coldness with dry skin of the hands and the soles. Now, next homeopathic medicine that is castor equi. This medicine is used for thickness of the skin and epithelium of the palm and the sole region. It is indicated for cracked and a chapped skin of the palm region of the hands. Now, next medicine is Cistus canadensis. So it is indicated for hard, thick, dry, and cracked skin of the palm region. A patient is extremely sensitive to cold air and any form of cold. Working men develop cracked and thick skin on the palm of their hands. The next medicine is graphitis. So this medicine is very useful for the children's and middle-aged persons, and it is indicated for hard, dry, and cracked skin without affection of eczema. This medicine helps to reduce the tendency of a person for exfoliative keratolysis. Skin complaints reappear during summer. The next medicine is lycopodium. So, lycopodium is useful for the dry and the shrunken skin of the palm and the sole region in summer. A patient complains of profuse sweat on the feet and the hands. Skin becomes thick and indurated with brown spot here and there. The next medicine is natrum carve. So, this medicine is useful for dry, rough, and the cracked skin of the palm, which is associated with blisters on the tip of the fingers. It is useful for chapped hands after exposure to sun heat. A patient complains of profuse sweat. This is also a useful remedy during summer heat and after the suppression of hand sweat. Next homeopathic medicine is natrum sulph. So this medicine works best for the dryness and burning of the sole associated with the blisters and the vesicles on the toes and the feet region. Patient complains of dryness of the skin during damp weather. Next medicine is petroleum. So petroleum is indicated for dry, cracked, rough, and the leathery skin of the palm of the hands. It is useful for chapped hands or the fingers, bleeding, especially for housemates. This is a remedy for the patient who work in water like fishermen and the housemates. A patient complains of thickness, dryness, rawness of the hands. They complain of deep cracks at the tip of the fingers. And the skin symptoms are aggravated every winter and disappear in the summer season. Now, next medicine is sarsaparilla. So sarsaparilla is a wonderful homeopathic medicine for the deep cracks on the fingers, toes, and the sole parts of the feet. A patient complains of dry skin after exposure to cold air and working in the water for a long duration. Next homeopathic medicine is selenium. So selenium is a useful homeopathic medicine. Selenium is a useful homeopathic medicine for the dry and the scaly eruptions of the palm region associated with itching. A patient complains of dry skin and the blisters between the fingers. Now the next homeopathic medicine for the exfoliative keratolysis is silesia. Silesia is useful for dry skin and eruptions on the fingertips of hands associated with profuse sweat. A patient complains of crack at his fingertips after exposure to damp and the cold weather. Now, our last homeopathic medicine for exfoliative keratolysis is sulfur. So, sulfur is a very wonderful homeopathic medicine for all complaints of skin, and especially for the dry, scaly, unhealthy skin of the palm and the sole region. A patient complains of exfoliative keratolysis after exposure to cold air, water, and detergents. Patient may complain of burning sole with a profuse perspiration. So, these are some homeopathic medicines which can be used for the treatment of exfoliative keratolysis, or simply you can say peeling off the skin of the hands or your palm. Okay, so that's all. In conclusion, I want to say that exfoliative keratolysis, while not a serious medical condition, what can be bothersome and affect the quality of your skin. So if you find this video informative and helpful, please give it a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insights into the world of homeopathy and natural healing. So thank you so much for joining me on this exploration of exfoliative keratolysis. So see you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from exfoliative keratolysis or any other health illnesses, then you can contact us for online appointments. On the screen, you can see how to contact us. So that's it for now, and thanks for watching this video.